Hi everyone, welcome to today's webinar on the Get Funding offer to improve animal health and welfare. We'll just wait for a few more people to join. Hi to everyone who's just joined. We're going to begin the webinar shortly, just waiting for a few more people. Hi, let's get started. Perhaps we can have the next slide, please. Right, so hello everyone. Welcome to today's webinar on the Get Funding offer to improve animal health and welfare. Today's webinar will focus on how the offer applies for beef and dairy cattle farmers. My name's Sonia. I'm a member of the Farming and Countryside Programme engagement team. I'm joined today by some of my engagement colleagues and colleagues from the Animal Health and Welfare Policy team. We'll just run through a couple of agenda and housekeeping bits and then we can get started. So first thing, this webinar will be recorded. This will be shared on the DEFRA Farming blog. You can find a link to where the recording will be uploaded in the chat. If you have any questions throughout the webinar, please submit these to Slido. The link has already been shared in the chat. And if you follow that link, it should take you through to a page with a chat box on it. And there you can submit your questions. Please have a read through any other questions that have been submitted before submitting your own to see whether anyone else has asked your question already. This helps us to get through as many questions as possible, and you can upvote questions using the thumbs up icon next to it. And this will move the more popular questions to the top of the list so we can get to them sooner. And just another thing to note, this is a webinar on the Animal Health and Welfare Get Funding offer, so we're only going to be answering questions on this topic today. And as for the agenda for today's webinar, we'll first cover what the Get Funding offer is and the recent expansion of the scheme to include multiple herds and flocks. And finally, at the end, we're going to hold a Q&A session and we can go through the questions that you've submitted to Slido. And that's everything from me, so I'm going to hand over to Chris now.
Thanks, Sonia, and good morning, everybody. So I'm Chris Maxwell. I kind of lead from the policy side, the Get Funding to Improve Animal Health and Welfare Service, which is what we're in here to talk about today. But that itself is one of the parts of the animal health and welfare pathway. So just before we start talking about that, a little bit of context on what the animal health and welfare pathway is. It's an initiative that's co-designed by government and industry. And it provides financial support to farmers in England to continually improve the health and welfare of their animals. At the moment, through the Get Funding to Improve Animal Health and Welfare Service, funding is available for cattle, pig, and sheep farmers. And that funding is there to work with a vet to improve the health and welfare of your animals. There are other funding streams available or that have been available. So we recently closed a round of the animal health and welfare capital grants. We were very heavily subscribed for that, and so which is kind of a great sign from a popularity point of view and kind of people wanting to improve animal health and welfare. So it was great from that point of view. But yeah, so we're currently assessing those applications that have come in, and we'll be in touch with offer letters to successful applicants in due course. If I could have the next slide, please. So the pathway also has some other aspects as well as providing financial support to farmers. We have done some work on looking at the use of, for example, labeling to help stimulate market demand. That work is currently on pause following a consultation which was done. But that's still there as an option for things we can do. We're also working to strengthen the regulatory baseline, and that's happened through the development of the penalty notices bill to give a more appropriate method for kind of enforcement of rules and regulations than was perhaps available previously. So something more like a speeding ticket rather than a big hefty, huge fine. And yeah, we're also the Secretary of State also announced earlier this year that we intend to consult upon the possibility of legislating for certain aspects around improving health and welfare, particularly on BVD and PRRS. Next slide, please. Okay, so they get funding to improve animal health and welfare service, which is not the catchiest title ever, so apologies for that. There are good reasons for it, but I won't go into them here. But yeah, that's what we're here to talk about today, and that's where that's where farmers can get an agreement to access funding to have a vet out on their farm and help them look at how they can reduce endemic diseases and conditions. And through that, improve the productivity of their animals and also improve the welfare of their animals. There are two types of visit available with two separate with funding for both for both types of visit. So the first one is the animal health and welfare review. Next slide, please. Okay, so it's a really busy slide this, but just going into a bit more detail on what the two different parts of the service do. So the first part, which you kind of it's part where everyone starts when they join the service and when they've got an agreement. That's the animal health and welfare review, and that's really the kind of flexible kind of toe in the water type part of the service. So that is funding to get a vet out on a farm and to talk about any health or welfare related issues that there may be on that farm. And yeah, kind of whatever that conversation looks like is entirely up to the farmer and the vet to decide. So that's you could talk about medicine usage, you could talk about management practices, biosecurity, entirely kind of focused on what's the most relevant thing for that particular farm. The only thing we do ask that happens during that is testing for a priority disease or condition. So in sheep, that's resistance to wormers. In cattle, that's testing for BVD. And in pigs, that's testing for PRRS. Obviously, today we're talking cattle, so it's the BVD aspect that's mainly of interest here. Once you've done that review, if you're interested, then there's further support available through the endemic disease follow-up. And this gets a bit more specific. And depending on what the test result was from the review, depends really on what you do in the follow-up. But it's very focused on doing more detailed testing to identify the kind of size and nature of the problem that you have with a particular disease. And is then also about providing additional advice on how to get rid of that disease and through that improve the productivity and welfare of your animals. These things can be arranged completely flexibly throughout the year, and once you've got an agreement, it's up to you whenever you have a review, and then the follow-up is completely optional after that review. So it's entirely up to you when you have them. You can time them to fit in with either existing like vet schedules that you have, or particular times of year where it's better for the farmer to actually have a visit out and to have a vet out. And particularly that's relevant for sheep, where when talking wormers, kind of spring, summer, early autumn are probably the best times for getting you really useful information on resistance to wormers. Right, next slide, please. So the important bit, payments, what we're talking. So the amounts that are on screen there are per herd, they're not per animal. I should point that out immediately, otherwise we'd be inundated if that was per animal. Of most relevance here today is the kind of the beef and dairy figures. So for an animal health and welfare review, they do vary. For dairy, it's £372, and for beef, it's 522. That difference is purely because there's a slight difference in the type of testing that we ask to be done. So if it's a dairy herd, bulk milk testing is fine, which is a lot cheaper than blood testing, which is what we ask for a beef herd. Now, this flips around in the follow-up so that for a beef herd, you get £837 for your endemics follow-up, and that's to cover the cost of doing a PI hunt within that herd, and if you've tested positive for BVD in the review. Now, if you haven't tested positive for BVD in the review, there's no point doing a PI hunt. You'll be bleeding your animals unnecessarily. What we do offer is £215 towards the cost of a biosecurity assessment. So if you want to get your vet out and do a biosecurity assessment, then there's £215 worth of funding towards that if you tested negative for BVD in the review. For dairy, it's eggs. Oh, sorry. Thank you. For dairy, the figures are changed, but it's basically exactly the same rationale. So if you tested positive for BVD in the review, then you get £1,714 towards the cost of a PI hunt, if positive, and then if negative, it's £215 for a follow-up without a PI hunt, which is just again focused on that biosecurity aspect. The reason for the difference in payment rates here is just to do with the average size of beef and dairy herds. Dairy herds are on average bigger, and therefore, because you're testing every animal, there is a high level of cost associated. We know that's averages, and we know there'll be some people where they will have a larger than average or smaller than average herd. But we can't account for every situation and every farm. We just have to have a single payment rate, and so the way we've done that is by looking at the average size of herd. Right, next slide, please. Okay, so what actually happens on the different things for cattle? So just to mention, there are some eligibility criteria here. So on the day of the visit, there have to be 11 or more. This is beef, but it's the same for dairy too. There has to be 11 or more beef cattle registered in England that are actually on the farm at that point. It's pretty much that simple. The only other thing you need to get an agreement is to have an SBI number with a linked CPH that's in England as well. And as long as you've got those things and your DEFRA ID to hand, that's basically all you need to apply. Application currently is taking about, I think it's about 76 seconds to apply for an agreement, and about 2.5 minutes to do the claim afterwards. Okay, so in terms of the review, I've mentioned it already, but it's a for beef cattle, it's a BVD blood serum antibody test that must be carried out. Apart from that, entirely up to you how you use the time with your vet. So like I say, it could be medicine usage, could be biosecurity, could be management of the farm, could be buying and selling, it could be anything else that you want to talk about. If there's a particular health issue, then that's absolutely fine to talk about as well. So that's the review for beef. For the endemic disease follow-up, as I mentioned, it's the PI hunt that happens if the BVD test was positive in the review. There is an option that if the vet suspects BVD is present on the farm, despite a negative test in the review, say because I don't know, some animals weren't among the ones that were tested, and since they actually look a bit kind of suspect, or they're displaying symptoms, then you can opt to have a PI hunt as part of your follow-up, as long as it's on the advice of a vet to do so. For both the for both a positive for both an endemic disease follow-up that includes a PI hunt and one that doesn't include a PI hunt, a biosecurity assessment must be completed. So that's the other aspect of this that must be done. Obviously, if you tested negative in the review and you do an endemic disease follow-up and there's kind of no suspicion of BVD on the farm, then the funding would just be for that biosecurity assessment. Yeah, next slide, please. Pretty much the same for dairy, except the difference in the review is that you do the bulk milk test. And in this instance, it doesn't need to be the vet taking that bulk milk sample. It can be the farmer, as long as the vet's confident that the farmer can do so in a way that isn't going to lead to a false result when tested. Yeah. So, but apart from that, they're exactly the same, except for the payment rates. Yeah. Next slide, please, Maddie. Okay, so once the visits happen, the vets come out to your farm, you've had conversations, testing's been done, you can expect a written report from the vet, which is kind of a record of what was discussed on the visit. It'll probably have like recommended actions to take and that kind of thing in it, as well as the results of tests that have been taken. That is just for the farmer. And that's the information that's in there stays between the farmer and the vet. That's not something that DEFRA or the RPA will ever ask to see. The farmer also gets a vet summary sheet from the vet as well. And that is kind of a more limited set of information. And that summary sheet is designed to have everything on it that the farmer needs to make the claim. So there's a list of all the information that needs to go on that summary sheet, which is in our guidance on gov.uk. And that, yeah, the list is relatively short, to be honest. We don't ask for a huge amount of information from the farmer when they make the claim. But yeah, that summary sheet should include all the information that the farmer needs to make the claim. The difference here is that summary sheet is something that DEFRA or the RPA may ask to see just to help with processing claims, basically. Just kind of like random claim checks. That's the only time we'd really ask to see that summary sheet, but we might ask to see that part. But anything that's in the written report, the more detailed report, we wouldn't ask to see that. Okay, next slide, please. So there are a couple of timing rules around this. Just try and keep things roughly annual, and so the agreements are based on a farmer being able to have up to 3 reviews and up to 3 follow-up visits before the 19th of June 2027. And there is still just time to do that if you're organised. So that the kind of the cycle that we say to do, and this would be roughly kind of every 10 to 12 months, we suggest do this, is to kind of register and get your agreement. Once you've got that agreement that has a number on it that starts with the IAHW, then you're good to go. And you can do a review. You can then claim for that review. Once that review has been claimed for and that claim's been approved, you can then do a follow-up. Now the follow-up has to happen no more than 10 months after the review. So do review within 10 months' time, do a follow-up if you want to do so. You don't have to do the follow-up. But if you do that follow-up, then claim for it. And then you can repeat that sequence every 10 months So you can have a review every 10 months, and you can have a follow-up every 10 months. And so the 10 months are there, the 10-month gaps are there just to roughly space this out, so that it's done more or less annually. And so I think the key thing here is to get the timing right with when you do your first review, because the timing on that one then starts to build in when other things can happen after that. So it's just worth kind of thinking about getting the timing right for that first review, because then everything else kind of follows on from that. But it's relatively simple, and yeah, like hopefully vets can kind of help keep people on track as well. And we intend to be kind of sending out like automated reminder emails to help people understand when they've still got things that they can do. We're not quite there with those yet, but that's one of the improvements we want to make to our service in the future. All right, next slide, please. Okay, so the big thing and the big reason we're here was because on June the 26th, we added the ability for farmers to be able to claim for multiple herds or flocks of the same species under the same agreement. So every herd or flock that you've got under the same SBI can now be claimed for. Prior to this, that wasn't the case. And this kind of received a positive response. So there are positive pieces on this in Farmers Guardian and Farmers Weekly, and we got a nice quote from the president of the NFU supporting this as well. So yeah, so it's because we can now, so through one agreement you can have you have the vet out to look at every herd or flock of every species of animal you've got on the farm, as long as it's cattle, pigs, or sheep. We don't cover chickens or geese or anything like that. Okay, next slide. The big question here, I guess, is what is a herd or flock? And we we don't want to be overly prescriptive with this, because we recognize that every farm is going to be a little bit different. So what we expect to happen is that the vet and the farmer agree that a herd or flock is different, and we provide some guidelines as to reasons why that herd or flock might be separate. And we also ask for a reason to be given by the farmer when they make a claim. So some of the reasons are there. So that might have separate management needs. Maybe year-round calving versus block calving. Could be different vaccination schedules. You might have different breeds on farm. You might have a pedigree herd and a commercial herd. Or you might even have herds at different locations that just physically never meet because they're never in the same place at the same time. So it's those kind of things that would make us think that it was a separate herd or flock, and as long as your vet agrees that it's a separate herd or flock, then that's fine. You can submit a claim for that herd as a separate herd. And when you log into our service to make a claim, and it's a second one, like the second one of the same species, it asks you to name the herds, and that's so that we can understand that they're separate herds, and so that just to help you manage them and remember which ones you've claimed for so far and that kind of thing. Yeah, so that's kind of the big thing that we did. It's proven quite popular already with particularly with beef farmers so far, and we've had quite a few multiple species beef claims in, and I think one farmer has already submitted one claims for 10 individual sheep flocks as well. So people are starting to use this and get the benefit from it for all their herds rather than just one as they've had to do previously. Right. Next slide, please. Okay, so that's just a QR code. You'll be pleased to hear this is the end of me talking. But yes, if you scan that QR code, that will take you to the page where you can start an application to get the agreement. There's also a link there to our guidance. And then yeah, if you haven't done either of those things, if you just Google improve animal health and welfare, kind of the top results. So that just takes you to the right place too. Um, I'm a person from DEFRA. It's great that it's great that I've been able to talk to you all, and I really appreciate that. But it probably more useful actually to get a kind of a real farmer's perspective. And so at this point, I'm just going to hand over to Adam Quinney for him to say a few words about how this can benefit him as as a person doing the actual stuff rather than just me talking. Thanks, Adam.
Okay, thanks, Chris. I'd just like to say that grass behind me is not as green this year as it was last year when I took that photograph. Um, Chris has outlined the sort of the purposes and so on of the scheme. I sit on the beef co-design group. In fact, I chair it, taken on that recently, to try and make sure that as far as possible, these schemes fit in with farmer need and business need. And I have to say, DEFRA have been really responsive to that. We've seen, as Chris says, the multiple species. So the vet can visit your farm now and talk about sheep and cattle, which, especially for worm controls and various things and rotational grazing, is really important to bring those two species together. And it's also been good this year that we've have multiple applications for the same species. So for instance, we've got a finishing unit and we've also got a suckler herd. Now the finishing unit is managed separately. You know, it's got different biosecurity risks. It's got different background of where we're buying the stock from and so on, and vaccination. And on the suckler herd, which is a closed herd, again, it's got different priorities for the vet to talk about. What I think is important, though, is you talk to your vet about, perhaps before you apply, to find out what's the best time of year to apply. Because Chris has gone over, if you do have a persistently affected animal for BVD, you've got to go back quite promptly and start looking for the PI within your herd. So you don't perhaps want to do that in the spring. So because you want all your cattle are outside, but your cattle might be inside, so that might be appropriate. So talk to your vet first, I suggest, before you start on the whole process. Why should I do this as a farmer? Well, I was doing a lot of it already, as most farmers are doing it for farm assurance and so on. But this has given it added structure and financial help. And with other monies we were getting in the past from government going into other pots now, this has been extremely useful. And I think you may ask yourself, so why focus on BVD? Well, BVD testing and eradicating BVD will become more legally based in a few years' time. So it's an opportunity to start the process within your own herd to get on top of BVD, which has lots of positive implications for getting on top, not just for fertility and so on, but also for antibiotic usage in the future in the herd. So our co-design for all this has been saying to DEFRA, you need to help us what individual farmers cannot do. So that's why BVD, it needs a national approach, because no point you forever trying to deal with it by yourself if your neighbours aren't approaching it and sorting it out as well. So it is about asking DEFRA to help where we as individual farmers cannot do this, and also where there's very little financial return short term in dealing with some of these situations. The beauty of this scheme is there's actually very few priorities between sheep and cattle that DEFRA have set out. They are bespoke to your vet and to your herd about how you approach this. And I think that's really important, because some of these diseases are not UK wide. They might be geographically in regions higher than others. So it's a really good opportunity for you to have more time to sit down with your vet and use his or her skills to really improve and move on animal health on your farm. That's enough for me, I think, Chris.
Excellent. Thanks, Adam. It sounds much better when you say it than when I say it.
Right. Thank you very much, Chris and Adam. So we can now begin the Q&A session. So if you haven't already, please submit any questions you have to the Slido, and you can access this through the link in the chat or via the QR code on the screen there. Okay, so we'll move on to the first question. Will prevention or vaccination be advised rather than treatment, as the NOAA livestock vaccination guidelines advocate that vaccines should be the norm rather than the exception?
Question. So I think that we're not saying that we are not going to tell a farmer and a vet how to do things on their farm through this. And so actually, I think where vaccination is appropriate, then absolutely the vet should be advising, and there will be a lot of situations where vaccination is really appropriate. I think the only thing just to kind of bear in mind is that if vaccination is likely to affect test results, maybe by giving kind of false positives that are based on presence of antibodies because of vaccination rather than because the disease is actually there, then that just needs to be kind of borne in mind in terms of kind of when testing and kind of when interpreting the results. But I mean, obviously, vets know that much better than I do. But yeah, absolutely, vaccination, one of the big tools in the armory, and yeah, should be used where it's entirely appropriate to do so.
And again, that's down to your veterinary advice, isn't it?
Completely, yeah.
Specifically for your farm.
Yeah, that's it.
Thank you. So the next question we have is, how can a herd that is already vaccinating against BVD and therefore it's seropositive for BVD engage in the program?
Yep, I mean that is that's going to need some kind of careful negotiation. I mean, I think there's funding available to help with testing it, and actually, if a herd that's already vaccinating maybe brings in new animals, then it might be that the funding that's available, it could be used to help test animals kind of before they join the herd. So yeah, there are things that can be.
But also, Chris, you're testing animals perhaps if you've got a breeding herd, you may be testing calves that
Yeah.
haven't yet been vaccinated.
Yeah.
So they'll be acting as sentinels to active disease within the herd. So you're not testing the whole herd, you're testing cattle under a certain age. And again, the vet will advise on which groups are most appropriate to test, say pre-vaccination.
Thanks, Adam. Thank you.
Thank you. Next question. When I have quoted clients for the cost for a PI hunt for a suckler herd and then a beef finisher herd at approximately £9 per blood antigen test plus visit and vet time, the extra funding does not cover the cost. Is the idea of the funding to cover all the costs or only some of it?
So
Some of it.
Yeah, I was going to say it won't cover all the costs in every case. It's designed to cover the cost of vet time plus testing, plus some money for farmer time too, for an average sized herd. But because it's an average, there'll be some that are much bigger and there'll be some that are much smaller. And for the ones that are larger, it won't cover the whole cost. But equally, it is a contribution that there wasn't there before. So it's I guess kind of not to be sniffed at in that sense.
And we did look on the co-design group about whether it should be per head, and the administration costs and the complication costs. We all know this through TB testing can get ratcheted up quite rapidly. So to keep it as simple as possible, but also to get herds, I would suggest some of the larger herds have already been engaging this, and some of the smaller herds haven't been. So it's about encouraging perhaps the people who haven't been testing in the past to get on board and start testing and having an appropriate program.
Absolutely.
Thank you. The next question is, how long will funding be available for?
Okay, so funding is well, and it says on the agreement that a farmer gets, but it's through until the 19th of June 2027. So what's that? Just under 2 years currently.
Thank you. The next question is, if a herd is found not to have BVD, can the follow-up discussion about biosecurity and prevention be done at the practice rather than visiting the farm again?
Yeah, I mean we don't specify how that biosecurity assessment has to be done. I think it would be really hard to have a good, meaningful, like useful conversation about a farm without having visited it. Whether if the information can be got at the same time as the review's done, then and actually that can be used for the biosecurity assessment, then that would potentially be okay, but it might mean that actually more time's spent on the review than the actual value of the payment for the review. So I guess there's a bit of a trade-off there. But I mean, I guess my answer is in theory, yes. In practice, it might be quite hard to do and to make a meaningful, kind of a meaningful assessment from. But yeah, again, that's going to be very much down to the individual situation, and in most cases, it would be, I guess, kind of expected that there would be some form of visit to the farm, but if one's already taken place,
Chris, it may
if there's
be
a very yeah,
it could work if the vet knows the farm very well,
yeah,
and if you've identified actually the problem you've got is buying in stock on your biosecurity, such as
yeah,
pedigree animals. What are you requesting of the herd status of the animals you're buying? Yes, that conversation could happen at the veterinary practice, but I would suggest if it's actually about on-farm activity and changes, and the vet doesn't know that farm very well, then I would suggest an on-site visit would be better.
yeah, great.
Thank you. The next question is there a minimum age for cattle to be tested? For example, would a calf rearing operation qualify for a visit?
So there are, the guidance explains the ages of the different groups that should be tested. I'm not going to run through them all now because I'll probably trip over them. But yeah, it's contained within the guidance for vets, exactly what kind of animals should be tested in it and in what kind of situation. I think in terms of a calf rearing, that would, yeah, depending on what age the calves are sold, that should be absolutely fine. But yeah, again, it's probably a bit of it depends. Read the guidance and just check that you're fine within that. Would be my advice.
Thank you. The next question is, many of our herds are already controlling BVD effectively. Wouldn't it be worthwhile expanding the endemic disease follow-up to allow the funding to be accessed to investigate and control other endemic diseases such as IBR or mycoplasma?
Yeah, it's really good. It's a really good point. I think from we can see this as a bit of a starting point, and BVD is something that there has been a lot of activity on. There've been a lot of pushes to eradicate BVD previously, so it seemed so there's momentum there, so it seemed like a good place to start. But absolutely, there's the possibility to kind of add to this and to potentially build in additional diseases. But to do that, we really need to see this being a success for BVD. And because that success breeds success from that point of view. That the more people do this, the better it is, and the kind of stronger the case is for doing more and for adding more diseases to it.
Thank you. The next question is, please can we have clarification on the exact timelines between possible visits? For example, does an endemic follow-up affect when the next first visit is possible?
Right. So there are three 10-month rules. So you can't. So so for that example, the endemic follow-up doesn't affect. It just needs to have happened before the next review. Reviews. So the three rules are: reviews can't happen any sooner than 10 months between each other. So if you do a review on the 1st of January 1 year, the soonest you can do your next review is the 1st of October that year. That's the soonest you can do your next review. If you did a follow-up in between those two reviews, then that follow-up would have to be within 10 months of the review that goes before it. That's rule number 2, that a follow-up has to be no more than 10 months after a review. And then the third rule is that follow-ups have to be spaced out at least 10 months apart as well. So if you did a review on the 1st of January 1 year and you did your follow-up on the, I don't know, 1st of June, for example, then that's absolutely fine because the follow-up is within 10 months of the review. And then you did your next review on the 1st of October, which would be the first possible day you could do your next review. Then the next follow-up couldn't be done until the 1st of April the next year, because then the follow-ups are 10 months apart as well. So basically it's keep reviews 10 months apart, keep follow-ups 10 months apart, and if you're doing a review and then a follow-up after a review, keep those within 10 months of each other. Yeah,
Thank you.
hopefully that was clearer.
If you do go to the DEFRA website, it does, and Google search, and perhaps someone might put the message up for everybody about the link. It does take you through all the timelines and sets out sit down with a cup of coffee and read it. It sets out all the criteria for number of cattle or sheep you have to have, and those time periods that Chris just went through to perhaps understand it, and it sort of sets out all the follow-up periods as well.
Thank you. So the next question is, are there any timescales for animal health and welfare grant applications that Chris outlined in the presentation?
Sorry, Sonia, could you just repeat the question again?
Yeah, so it's about timescales for animal health and welfare grant applications.
Okay, so the capital grant applications have closed currently. Yeah, and we would like to do another round of those, and that's our intent. I don't know exactly when that will be. In terms of timescales for the round that's closed and when people can expect to hear, I'm afraid I don't know the answer to that. I do know that applications are being assessed, but there are a lot of them. So I think yeah, it could be a little while, yeah.
Thank you. So the next question is, if an antibody positive found at review visit, there is no obligation to do a follow-up visit to do a PI hunt, though it's a good idea to do so. So is there an obligation to do a follow-up visit?
No, there's no obligation to do so. I think if you found a positive and you choose not to do a follow-up, fine. That's absolutely the farmer's prerogative. I guess all I would say on that is that that's going to be starting to hurt your productivity. You're much more likely to lose animals either before or after birth, and you're much more likely to have animals that take longer to get to weight. So yes, there might be a reason for doing that, but yeah, it would be it would seem odd
Chris,
to not do so when the
the
money's
only
there.
time perhaps
Go
you
for it.
wouldn't want to do that follow-up and search for PI, I could imagine, is if you've got a finishing unit and that's all the cattle you've got on the farm, you're not breeding cattle, and the unit, you're going to be killing all the cattle in that unit in the next 6-8 weeks. Well, there's
Yeah.
no point doing a follow-up. But if you're breeding, then why not take up the support that is available to chase for the PI? Because bearing in mind, this is coming into legislation in a couple of years' time. So this is an opportunity to use some funding to remove any PIs from your breeding herd. But I could understand it if it was a finishing unit, say an AFU, and everything was going off to slaughter in the next couple of months. I could say, what's the point doing a follow-up? They're all going to be slaughtered in the next 2 months. Fair enough. But if you've got a breeding herd, I would advise you actually take up the advantage of the financial support to go and do that PI hunt.
Yeah, absolutely.
Thank you. So the next question is, if all animals need to be tested for a PI hunt, can bulk milk PCR test be used to check for a PI in the milking cows?
Well, that's what you do initially, isn't it?
Yeah. I think it's I mean, I think that we kind of worked really hard on the exact testing guidance to try and make it fit for purpose for every farm. So I would recommend that have a look at the testing guidance and see how that fits with the operation in question. I would. I think, and Adam, tell me if I'm talking absolute nonsense here, but I think doing bulk milk to identify PIs would not seem to me to be the most effective way of doing it. But yeah.
Well, the thing is that the bulk milk test says, have I got BVD in my herd? And the PI is about an individual animal test.
Exactly.
So I can't see, you have to test the individual animals individually to find out that one PI, hopefully only one PI within your herd.
Thank you. So the next question is, for the PI hunt, can we pull the samples? So if negative, all those samples in the pool would have a negative result to make the money go further and cover more of the testing? Or does each blood sample need to be tested individually?
Individually.
Yep.
Okay, thank you. The next question is, it is usually accepted that if a calf is not a PI, its dam is not a PI, but to get the funding, all still need to be tested.
If you
Yes.
found that's only when you found BVD within your herd being active. So the first test is you just test 5 animals, minimum of 5 animals, to see if you've got BVD active within your herd. It's then on the review on the second visit, if you wish to carry on, is when you do an individual blood test on all animals to find that persistently infected animal. Does that make sense?
Yeah, and I think I understand the kind of the question about inferred status of dams. I think when we were looking at this, we didn't just do this by ourselves. As kind of Adams suggested, there was a big group of farmers and vets helping us with this. Just testing every animal seems to be it's the way that works on every farm. And yeah, because inferred status is fine, but it's not actual. It's not quite the same in every single instance as actual status. So there is a bit perhaps unusual to do bloods on every single animal, but it is the surefire way that works on every farm to identify every animal that is persistently infected.
Thank you. The next question is, calves under 6 months old cannot be tested for BVD antibody due to interaction with maternal antibodies. Therefore, in those herds already vaccinating for BVD, could we do an antigen test on calves or ear tag sampling instead to allow engagement?
So one of the ways of doing the PI, one of the ways that we do allow the PI hunt to be done is by a kind of a supplementary button tag. So that can be part of the approach that's used within a herd. Excuse me.
Thank you. The next question is there a database in preparation to record BVD herd status?
So we're asking farmers to provide us with the results of their tests as part of their claim. We are not, through this service, looking at how we're not looking at building like a publicly available database where people can go on and search up the the kind of the status of animals that they're potentially buying. But farmers will have a test certificate from the testing that they've done that provides the same information as that kind of publicly searchable database would do. We are looking at using the test results that farmers give us in an anonymous fashion to try and identify how much BVD is out there, basically. So how prevalent is it? But we're looking at using that information at a national level, not at a farm level. So absolutely not using any of the kind of test information that we're given to target individual farmers, or and certainly not looking to use it to kind of as any kind of punishment or like enforcement or compliance kind of activity. It's absolutely not for that. We've committed to using that data anonymously, except where any of the data that's submitted to us is needed to help process a claim and get the farm the money that they're owed.
Thank you. So the next question is the BVD PI hunt with an ELISA antigen or PCR testing, please?
I would suggest read the guidance and just check what that says. I know that sounds like a bit of a cop-out, and I should know this off the top of my head, but I don't want to give the wrong answer right now. So the best thing to do is to check the guidance. We do occasionally update that, so it's better to do that, and then it's you've got the latest information on what's required. So yeah, I'd suggest do that rather than me give an answer right now.
Thank you. And the next question is for clarity. Isn't 10 months after 1st of Jan, 1st of November, not 1st of October?
I knew someone would catch me out on my maths with this. Yeah, probably. Yes. Yeah.
Thanks. And the next question is, how is this funding different from grants? So Chris said that grants were closed, but is this going on until 2027?
So this funding runs through until 2027. This is not a capital grant. This is funding to carry out a specific range of activities, which are the ones that we've talked about, which is the testing, the advice from a vet. So this is funding to do those things. The capital grants that I was on about previously are to purchase bits of equipment to and those bits of equipment are there to improve animal health and welfare, so like cattle crushes, that kind of thing. But they are not. This is just about providing funding to have a vet come out and do some testing and to provide advice to the farmer. So that's what the payment here is for. It's technically also a grant, but from a government bureaucratic point of view, we still call it a grant, but it is different. And this funding will run until the 19th of June 2027.
Thank you. The next question is, can you run two IAHWs at the same time, one on cattle and one on sheep?
So you can do it all under one agreement. You don't need two separate IAHW agreements. You can run it all under one agreement. So, but yeah, absolutely. Under the same agreement, you can have your vet come out and do testing on your sheep flock, on your cattle heads, and if you have pigs as well, you can have it done on pigs as well. So you can do it for all the species and all the herds or flocks you have of those species, all under one agreement. And then it's just you do the individual claims for them, but it's all under the same agreement. So you just apply once and then claim many times afterwards.
Thank you. And the next question is, why are we not allowed to pool samples at the lab level? Obviously, if there was a positive in the pooled group of 10, the lab would then individually test each animal in the pool.
So the
There's
there
a good logic to that. Chris, there's a good logic to that. That's quite interesting, actually. Yeah.
Yeah. If you want to explain it, Adam, you go for it.
Well, I think what they're saying is, rather than testing, you take a sample from each animal, you put some in a pool, you test that pool. If you find a positive, you then go back and recheck all the individuals to find the persistent infected animal within that, say, 50, if you're doing a lot of cattle. I think that's something, Chris, I think we need to bring up at the co-design group to discuss more in detail with the vets on the panel there. To me, that seems a sensible approach to cut the cost.
Sure. I think I guess the only thing I would say there is if we were to make that change and if it were to make it substantially cheaper to do, then we recommended that was the way to do it, then we'd probably bring down the payment rate as well because
Except,
we can
Chris,
only
I
pay
think
for
what
things
this
that
would
we've
refer to would be sort of larger herds,
done.
which would be perhaps if you've got 700-800 animals, something to do, this
Sure.
would be an appropriate thing to do. And so I think we need to discuss something we discuss at the co-design group. That's all I can promise at this stage on that.
Yeah, sure. I think we just need to be really careful about because as soon as we start drawing a boundary and saying, oh, actually above X number of animals, you can do
Yeah.
this type of testing, and below you do this type of testing, then wherever we set that line, that there'll be people will be the wrong side of the line, and yeah, so it's something we can look at, but yeah, anything that makes this more complicated, and kind of introduces more like difference and rules is something we need to just think really, really carefully about before we do. Yeah, let's have a look at it.
Thank you. I think we have time for one more question. So if doing a BVD PI hunt, will the funding cover potential follow-up testing of animals that test positive to confirm they are PI and were not just viremic due to circulating virus at the time of sampling? And that's not clear in the guidance.
Yes. So if I think the standard is 3 weeks is testing the same animal 3 weeks apart to see if it's still showing as positive. So we would expect that confirmatory testing to be done as part of a PI hunt, yeah. But obviously it only needs to be done on positive animals.
Thank you. So that's all the time we have for questions today. Any outstanding questions we can answer on the DEFRA Farming blog. Thank you so much everyone for coming along today and for submitting questions. I hope this webinar has been useful for everyone and answered all their questions. I just want to remind you that this webinar was recorded and the recording will be uploaded on the DEFRA Farming blog, and so you can watch it back. Thank you colleagues on the panel for coming along and speaking. I don't know if there's anything else you want to raise before we close.
And just say thank you for everybody for attending and for such good detailed questions.
But I think also this is something it's not set in stone. So keep those questions coming through the blog website and suggestions about how it can be improved and streamlined, because through the co-design group, we have found DEFRA to be responsive to positive suggestions to make the whole thing run better. So please keep those suggestions coming, or contacts for your trade association or whatever, because the BVA involved, the NFU is involved, the National Beef Association, etc. So through your organizations, please don't hesitate, because I think what is important, we've got approximately 10,000 farm businesses signed up to this, is that we get more people signed up to it, because if we can demonstrate, this is quite important, that we demonstrate to DEFRA that this is supported by the industry and wanted by the industry, then it can be developed further.
Right, thank you so much. So thank you everyone for coming today. And yeah, don't forget that the recording will be on the blog. Have a great rest of the day.
Thanks, everybody.